This is part 2 of the case study on male pelvic instability. We were successful in our ability to mobilize the left downslip, and I will show you the findings. We now can take up the slack, and it takes up fairly quickly on the left, and when we spring it, you can see the recoil, and now I let go. When I spring it superiorly, now I can create movement. Okay, it didn't move at all before. I take up the slack, and now I spring it, and look at the healthy recoil. So with respect to a vertically directed force, we have improved this. Now, I come back to palpating the sacroiliac ligament and the ischium. And what I find is that he feels normal on the right, and the left sacroiliac ligament is still somewhat lax and deep. So I have to speculate what would make this ligament remain lax when we have improved the positioning. And the answer is pretty straightforward. He has a permutation of downslip on this side, which I discovered a long time ago, maybe 15 years ago or so, in which the ilium can also go downslip in an oblique direction. And I call it oblique downslip. Now it's not apparent in this position. I can take up the slack and I can spring him in an oblique manner, and I can also go the opposite direction. However, when we get him up in yoga child pose position, that will change. So if you could kindly get up. We may have guests any second because the dogs are going wild, so I don't know. Maybe they hear a car or something. In this position, on the right side, I can take up the slack towards the opposite shoulder and I can spring and the body accepts it. Hang on one second. So on this side, on the left side, his PSIS just doesn't feel the same. And maybe I'm feeling ligamentous tone over it. It's a little bit deeper and it's a little bit inferior. And when I try and spring the left PSIS towards his right shoulder, it's almost a shearing movement. There's no movement. When I go the other direction, same thing. And I'm capturing it in this little indentation I call the interthenar non-eminence. It's a joke because this is called the hypothenar eminence. This is called the thenar eminence. So this guy gets named the non-eminence. Okay, so that's where you capture that PSIS right in there. So what he has is a Hesch oblique downslip of the left ilium. We're going to treat that and then we will film that portion in a very short while. Thank you.